Hello everyone. For today's session, we will be discussing about the multidisciplinary approach in taste disorder. These are the contents of the presentation, consists of multiple disciplinary approach in context of therapy for the taste disorder in dental, ENT, medical, and nutritious approach, and also case study. Before we discuss deeper on the taste disorder, I will briefly explain about the normal anatomy of the tongue. The tongue has a lingual papilla, consists of filiform, fungiform, valent, and foliate papilla, but only filiform papilla are not associated with any taste bud. The tongue is also equipped with many taste buds on its dorsal surface, and it can detect the substance that are sweet, bitter, salty, sour, and umami. For the introduction, taste disorder is defined as taste perception, which is unpleasant taste inside the mouth. It may be caused by the infection of upper respiratory and ear infection, radiation therapy, high exposure of chemicals, head injury, surgeries, and poor oral hygiene or dental problems. Taste disorder can be classified into three types, which are hypogeusia, which reduce the ability to taste, ageusia, complete loss of taste, and dysgeusia, also known as parageusia, is a distortion of the sense of taste.
Now, we are going to clarify on multidisciplinary approach for therapy on taste disorder, which are divided into dental approach, ENT approach, medical approach, and nutritionist approach. First of all, I will begin with dental approach for therapy on taste disorder. These are the treatment strategies on taste change from Journal of the Canadian Dental Association, as you can see from figure 2. After patient-reported taste change, comprehensive history and clinical examination will be recorded. Next, imaging such as MRI or CT scan will be taken to rule out trauma, local or systemic considerations. If imaging remarkable, the case presented will be referred to medical practitioner, and if otherwise, the case will be considered for surgery or treat symptomatically. Then, hematologic tests such as complete blood count or differential will be examined. If the result is abnormal, the case will be referred to primary care physician for treatment, and if unremarkable, the case will be considered for surgery or treat symptomatically. The patient will then be reviewed on current medication and referred to primary care physician for trial medication of high-dose zinc supplementation. Several studies indicate that zinc may be helpful in the treatment of idiopathic dysgeusia. If it provides positive effect, zinc will be continued until improvement, and if otherwise, the patient will discontinue zinc and treat palliatively, and then the patient is considered for surgery or treat symptomatically. After that, oral cultures will be taken if there are infections suggested. If remarkable, the patient will be treated based on culture results, and if otherwise, the case is considered for surgery or treat symptomatically. Lastly, salivary flow rate will be examined. If the salivary flow rate is below normal limit, the patient considers to have trial or swallow gauge. If it provides positive effect, patients will be advised to continue use it until improvement, and if otherwise, the patient will be advised to increase hydration, use sugar-free candy or saliva substitutes, and then the case will be considered for surgery or treat symptomatically.
Next, I'll discuss on ENT approach in taste disorder. ENT stands for ear, nose, and throat. To distinguish most flavors, the brain needs information about both smell and taste. These sensations are communicated to various areas of the brain from receptors in the nose, mouth, and throat. Taste disorder can range from obstruction in mouth, damage to the nose, brain, and nervous system in general. From the picture, thousands of tiny taste buds cover most of the tongue surface. A taste bud contains several types of ciliated taste receptor, and they detects the 5 basic tastes, which are sweet, salty, sour, bitter, or savory, also called as umami. The nerve impulses from the taste buds are transmitted to the brain through the facial and glossopharyngeal nerves. Whereas, the olfactory epithelium is an area of the nasal mucosa in the upper part of the nasal cavity. The smell receptor in this epithelium are specialized nerve with cilia that detects odor. The nerve impulses is transmitted upward through the cribriform plate and across the synapse within the olfactory bulbs. The olfactory nerve transmits the impulse to the brain, which interprets the impulse as a distinct odor. Information is also sent to the middle part of the temporal lobe, where the smell and taste receptor is located and in which memories of odors are stored. And finally, the brain interprets the combination of impulse from the olfactory and taste receptor along with other sensory information such as the food's texture and temperature to produce a distinct flavor when the food enters the mouth and chewed. There are some causes that may lead to taste disorder. First one is head trauma, which may cause damage to central and peripheral nerves, and one may experience ageusia or dysgeusia. Secondly is nasal and sinus diseases such as rhinitis, chronic sinusitis, nasal polyps, and adenoid hypertrophy. And this condition may cause obstruction to the nasal pathway or may alter the signal transduction. Thirdly is upper respiratory infection, which may lead to hypergeusia as infection may produce mucus and may alter out taste and smell receptors. And next point is ear infection, which is usually happen in children and caused by the upper respiratory infection. Inner ear infection can severely damage the major taste nerve as it passes from the tongue through the inner ear to the brain stem. And next is cigarette smoking. Nicotine, which is one of the ingredients of cigarette, may cause functional and morphological alteration of the taste buds. And next is radiation treatment of head and neck. Radiation alter normal oral flora, decrease the salivary flow rate, and it may resolve over time, but if the salivary gland is harmed during the radiation, the sense of taste may not fully return to the way it was before treatment. And finally is some medication may directly affecting taste receptors by changing the way the taste bud sends and receives nerve impulses, or by changing the amount or chemical composition of saliva. These are some of the examples of selected medication that reportedly alter smell and taste. We can see that there is antibiotics such as ampicillin, azithromycin, ciprofloxacin, clarithromycin, and also in other group there is antihistamine such as loratadine, and antihypertensives such as amilorides, and many more. The management for the condition that I've stated before is that by treating the underlying cause, for example, we can prescribe antihistamine, decongestant, and nasal steroid for the patients that are experiencing rhinitis, sinusitis, middle ear infection, and also adenoid hypertrophy. Also, we can prescribe antibiotics if the patient is infected by bacterial infections. We can prescribe through oral medication or ear drops if the infection is related to the ear infection. And also, we can prescribe antiviral and antifungal drugs if the infection is due to virus and fungal. Next is by doing a surgical removal of the obstruction. Example of the obstruction is nasal polyps and adenoid hypertrophy if it is severe and unable to shrink. And next is by advising the patient to quit smoking. And finally is by prescribing a suitable medication, as some medications may not suitable to some people.
The next multidisciplinary approach is medical approach, as taste disorders can be caused by systemic diseases too. Firstly is diabetes mellitus or high blood sugar. It can cause the disturbance of taste in the ventral two-thirds of the tongue. The treatment for this condition is first, type 1 is insulin treatment, and for type 2 is exercise and diet. However, medication, as example metformin, is prescribed if lifestyle is not enough to lower the blood glucose. The next disease is hypertension. Hypertension does not directly cause taste disturbance, but it is due to the drugs used to treat it. As example, diuretics. The treatment shown in the slide is directly for hypertension, which are first, lifestyle changes, exercise and diet, and second, medications, as example, diuretics, beta blocker, and calcium channel blockers. However, if taste disturbances occurs due to these drugs, switching to another type of drug for hypertension may fix the problem. If the mouth is dry to diuretics, sipping water between bites of food is advised. The next disease is gastroesophageal reflux. This disease can cause an affection of the pharynx, larynx, and posterior tongue even without symptoms of water breath. Water breath is the production of excessive amount of saliva that mixes with stomach acids that have risen to the throat. For this disease, the treatments are first, lifestyle and dietary changes, second, medications, as example antacids, histamine blocker, and proton pump inhibitor, endoscopic therapy, and lastly, surgery. The next disease that can cause taste disturbance is kidney diseases. Patients with hemolysis in the end stage of renal failure show changes of the oral cavity with xerostomia, fur, and taste disturbance. The treatment for kidney disease are first, we have to treat the cause, for example, medications. The example for medications are high blood pressure medications, medications to lower cholesterol level, medications for anemia, medications to relieve swellings, medications to protect the bones, and a lower protein diet to minimize waste products in blood. The next treatment would be dialysis and also kidney transplant. Multiple sclerosis is also one of the diseases that can cause taste disturbance. Multiple sclerosis is accompanied by peripheral and central affections for the mandibular nerve and intermediate nerve that lead to taste disturbance. For this disease, the treatments are divided into during the attacks and to modify progression. During the attacks, the drugs prescribed to control this disease are corticosteroids and plasma exchange. To modify progression of the disease, injectable medication such as interferon beta medication and oral medication such as fingolimod or Gilenya and infusion medications such as ocrelizumab and Ocrevus are prescribed as treatment. The next disease would be Sjogren syndrome. Sjogren syndrome is a disorder of your immune system identified by its two most common symptoms, which are dry eyes and a dry mouth. Most studies showing taste and smell abnormalities in patients with dry mouth are reported from patients with Sjogren's syndrome. The treatment for this disease are first, medications. The medications that is prescribed are to decrease the eye inflammation, increase production of saliva, address specific complication, and also treat system-wide symptoms. As for surgery, the surgery is to help with the dry eyes. The next one is sick building syndrome. Sick building syndrome describes a sum of unspecific irritative symptoms people suffer from in the internal part of buildings. Most of these symptoms vanish when they leave the building. The most causative agents are false function of the air conditioning, smoking, detergents, adhesives, building materials, furniture, bacteria, fungus, outdoor air conditions, as well as fast building ventilation without efficient vaporization of adhesives, and other solutions, fungal invasion of the building. Even psychological components such as bad working conditions may lead to SBS. Symptoms are tiredness, weakness of concentration, affection of the skin and mucosa, as well as unspecific allergic reaction with rhinitis, irritation of the eye, asthmatic complaints without diagnosis of asthma, and disturbance of taste and smell. The treatments for this syndrome is allergy medications and also to remove the triggering factors. And lastly, endocrine disorders such as Cushing syndrome, hypogonadism, diabetes mellitus, pseudohypoparathyroidism, and adrenal cortical insufficiency can result in aberrant taste function. The treatment for these are medication. Example, it is not systemic but synthetic hormones. Chemotherapy may also be used to treat patients with cancer of an endocrine gland, and also surgery. Surgery are in some cases, such as with cancerous and non-cancerous tumors on an endocrine gland. Surgery and or radiation therapy may be necessary to treat endocrine disorders.
Now we move on to a nutritionist approach. Similar to other approaches, the aim is to improve the taste sensation of patients having a taste disorder. As we all know, losing the sense of taste can create serious health issues. When taste is impaired, a person may change their eating habits where they will eat too little and eventually loses their weight, or eat too much and gain weight. Moreover, loss of taste can also cause someone's appetite to diminish, and this will cause them to add too much sugar or salt to make their food taste better. And this can arise a problem for people with certain medical conditions such as diabetes or high blood pressure. In severe cases, loss of taste can also lead to a depression. So, in order to improve a patient's sense of taste or to improve their appetite, some interventions, such as changing the food preparation, can be done. It includes by adding spices and a higher concentration of flavors and basic taste to make food more enjoyable. Some suggestions to improve food preparations are such as choose and prepare foods that smell and look good, use food with different colors and also textures, as this could help to increase the patient's appetite. Nutritionists should advise the patient to chew and move the food slowly around the mouth so that all taste and sensory receptors are stimulated. The nutritionist should also encourage alternate bites of different foods during the meal. Spicy condiments like peppers, horseradish, mustard, or salsa should be added to add more flavor to the dishes. Taking tart foods and beverages such as oranges, lemons, and grapefruits before a meal may improve flavor perception of the food that the patient's gonna take. The last one is to increase the savory, which is the umami taste, by using small amounts of monosodium glutamate, MSG, or eat food rich in MSG such as tomatoes, Parmesan cheese, and also corn.
Okay, now I will discuss about the case study. Okay, so here is the case study, which is Studying Human Gustation, a Multidisciplinary Approach by Emilia Lanili. So when studying taste, one must take into consideration multiple disciplines including anatomy, neuroscience, sensory science, and nutrition. But one must also understand how psychology, the characteristic patterns of thought, feeling, and behaviors that will influence taste perceptions, which will contribute to degustation. Okay, so here's in our first article, Lanili and Gutziel review human anatomy of the sense of taste and its ascending signal transmission. This study stated that signal transductions of sense of taste are along the ascending fibers through the tongue, medulla, pons, midbrain, the thalamus, the primary gustatory cortex, and the secondary gustatory cortex. The second article by Anderson et al. Focuses on a specific analysis of the gustatory electroencephalogram EEG signal. They examine the detections of subconsciously and near consciously distinguishable taste differences using the time resolve, also called the quantitative EEG analysis method, or as a short form QEEG. And on this study, the data show that an evident discrimination on the EEG signal is indeed possible. Here, it is interestingly shown that the QEEG presents itself as one of the few objective measurements of the human gustatory response. Okay, and here is showing our references for this topic. And with that, thank you.